Hi, I'm Ann with Lighthouse Coding, and today we're going to walk through your ICD-10-CM manual. Please ensure that you have your book handy so that you can follow along. I'm using the ICD-10-CM expert version published by AAPC. Your book may or may not look exactly like mine, but they all include the same basic information. Let's start with the table of contents. This will give us an overview of everything that's included in the book. The first listed entry is the ICD-10-CM official guidelines for coding and reporting. These official coding guidelines are provided by CMS and the National Center for Health Statistics and have been developed to assist the coder or provider in identifying the diagnoses that are to be reported. One thing that I do and that I would recommend you do as well is to go to the CMS website and bookmark the page for these official guidelines. When you're studying or working as a coder, have this website open in a tab for quick and easy reference. The guidelines are broken down into 4 sections. Section 1 includes the structure and conventions of the classification and general guidelines that apply to the entire classification, as well as chapter-specific guidelines. Section 2 includes guidelines for selection of the principal diagnosis. Section 3 includes guidelines for reporting additional diagnoses, and Section 4 provides guidelines for outpatient coding and reporting. Since we're learning physician or outpatient coding during this course, we'll mostly be focusing our attention on the guidelines in Sections 1 and 4. It's important to have a good grasp of these guidelines, not only for your certification exam, but also for use in your daily work. Knowing these guidelines inside and out will make you a much more productive and accurate coder. In Section 1, Guideline 1A, we have conventions for ICD-10-CM. These are the general rules of the classification independent of the guidelines. Guideline 1B talks about general coding guidelines. These include guidance on things like locating a code, the level of detail in coding, signs and symptoms, acute and chronic conditions, laterality, borderline diagnoses, and the use of Z codes. Again, read through these and keep this page up while you're working for easy accessibility. Some of these you'll remember quite easily, but for others, you may find yourself needing to reference them. Guideline 1C covers chapter-specific coding guidelines. 1C1 is for Chapter 1, certain infectious and parasitic diseases. 1C2 is for Chapter 2, neoplasms, and so on. We'll go over these chapter-specific guidelines in more detail later in the course. Section 2 covers selection of the principal diagnosis. This would be for inpatient facility coding. And Section 3 covers reporting of additional diagnoses, also for inpatient facility coding. Section 4 gives guidance on diagnostic coding and reporting guidelines for outpatient services. So here you're going to find information on things like the selection of the first listed condition, signs and symptoms, and uncertain diagnoses in the outpatient setting. We'll go through these in more detail as the course progresses. Page 3 gives us practical steps for using the ICD-10-CM book. This gives us some basic information about ICD-10-CM coding. There's guidance on coding structure and how to select the correct diagnosis code. This page covers symbols and conventions. Let's take a look at these. This box with a check inside of it appears after codes throughout the alphabetic index and the index to external causes to serve as a reminder that the code requires one or more additional characters. In the tabular list, you'll see these red symbols if the code requires additional characters. The numbers inside of the red circle tell how many characters the code requires. This blue symbol, the circle with the 7th symbol inside, cautions that the code requires an additional 7th character following the placeholder X. Certain symbols will alert you to Medicare code edits. These symbols indicate that there's an age conflict, which is a discrepancy in the patient's age and any diagnosis on the patient's record. An example of this would be a 5-year-old patient diagnosed with benign prostatic hypertrophy, which is typically a condition that develops later in life, or a 78-year-old patient coded with a delivery, which is usually something seen in a younger patient. So when we see these symbols, we're alerted to the fact that these will pertain only to patients in certain age ranges. The N in the red box will be found next to codes that are only applied to newborns, and the P in the red box would only apply to pediatric patients. M stands for maternity, and that's for patients between the ages of 12 to 55, and A is for adult, and that's for codes applicable to age ranges 18 to 124. These symbols represent gender, and when you see one of these, you'll know that the code only pertains to a male or female patient. Here are some other symbols in color coding. Manifestation codes are highlighted in light blue. These codes describe the manifestation of an underlying disease, not the disease itself. Therefore, they would not be used as primary diagnosis codes. Look at I68.0 and I68.2. They are highlighted in light blue because they are manifestations of an underlying condition. Bold green font is used in the code descriptors throughout the tabular list to quickly identify the key terms in a given category. An example is D12-2, benign neoplasm of the ascending colon. Notice how ascending colon is highlighted green. Macro codes are identified in pink. These will be covered in more detail later in the course. Other specified codes are highlighted in gray. These codes are assigned when the documentation indicates that a specific diagnosis, but the ICD-10-CM code set does not have a specific code that describes that condition. H01.8, other specified inflammation of the eyelid, is an example. In this case, the patient would have a specific type of inflammation, but there's no other code that specifically describes the condition. Unspecified codes are highlighted in yellow. These codes are assigned when neither the diagnostic statement nor the documentation provide enough information to assign a more specific code. Look at G58.9, mononeuropathy unspecified. In this case, the provider would have simply stated that the patient has a mononeuropathy with no other details provided. Coding tips appear throughout the tabular list to help you choose the correct code. Here is a tip found under 082. 082 is the diagnosis code for encounter for cesarean delivery without indication. The tip states, used when documentation does not support medical necessity for cesarean section or for patient convenience. Here you're just getting a little bit more information to make sure that you're selecting the correct code. Definitions in medical terms and conditions appear throughout the tabular list to improve your understanding of terminology. 080 is used for full-term, uncomplicated delivery. Under 080, there is a definition that states full term is greater than 37 weeks. This first symbol indicates the first trimester of a pregnancy and will appear with applicable codes that apply to the first trimester. The same goes for the second and third symbols. This symbol appears next to codes that are new for the current year. This one appears before text that is added for the current year. This black triangle is used with a code title that is revised for the current year. And these two triangles pointing inward are used for text that has been revised for the current year. There are also some instructional notes that you'll find throughout the tabular. Excludes 1 means not coded here. When you see this note, you are to never assign codes listed under excludes 1 along with the code that you cross-referenced, with some exceptions. An example of this would be type 1 and type 2 diabetes. Excludes 2 means not included here. This alerts you that most likely you will not assign codes listed under the excludes 2 along with the code that you cross-referenced. However, you could assign both an excludes 2 code with the cross-referenced code as long as the provider documents both conditions. An example is E36, intraoperative complications of the endocrine system. There is an excludes 2 note for post-procedural endocrine and metabolic complications and disorders not elsewhere classified. You'll also see the includes note immediately after certain categories to further define or give examples of what is included in that category. So under type 1 diabetes, Under the includes note, we see conditions like brittle diabetes, juvenile diabetes, and ketosis-prone diabetes. These are all conditions that would be included under the E10 code. When you see notes highlighted in red in the tabular list, these will provide additional coding information, like this note under C91.0 that states that codes in subcategory C91.0 should only be used for T-cell and B-cell precursor leukemia. The Code First alert will help you to determine which codes should be coded first. Here is one under G94, Other Disorders of the Brain and Diseases Classified Elsewhere. There is a note to code first the underlying disease. The Use Additional Code note appears on etiology codes throughout the tabular list to identify when to assign a manifestation code in addition to the principal or primary etiology diagnosis. Here's an example under H0281, Retained Foreign Body in the eyelid. We have a Use Additional Code note that says to identify the type of retained foreign body, Z18. When we see this, we know that if a type of foreign body was specified, like a piece of metal or glass, that would be coded in addition to the primary code. Code also means that two codes may be necessary to capture a condition, and sequencing of the codes will depend on the actual encounter. Under celiac disease, K90.0, there is a note to code also exocrine pancreatic insufficiency, K86.81, if documented. One other symbol that you'll see in the tabular is this AHA symbol. The American Hospital Association's Coding Clinic is a quarterly newsletter that provides official advice to help in selecting codes. When you see this symbol, it indicates that there is a related Coding Clinic article. There will also be a citation that includes the quarter and the year of the issue. If you have access to Coding Clinic, this is a great resource. A quick search of the Coding Clinic database can bring up any related articles so that you can ensure you're not missing valuable information as you select your code. Now let's take a look at the alphabetic index. This is an alphabetic listing of diseases and symptoms. This is your starting point when looking up a condition. We'll be using the main term when we look up a code. The main term is the disease or symptom. Under F in the alphabetic index, we can see main terms like fibroadenoma, fibroid, and fibromatosis. Underneath these terms are subterms. We want to scan these subterms to see if any of them apply to the documentation that we're reviewing. Under fibromatosis, there are quite a few subterms. If the documentation stated that this was gingival fibromatosis, then we are given the recommended code K06.1. The tabular list is a listing of codes divided into 22 chapters based on body system or condition. Once you've looked up a term in the alphabetic index, the next step is to verify the code in the tabular list. Using K06 from the previous slide, we need to go to Chapter 11, Diseases of the Digestive System, in the tabular list. This chapter includes codes from K00 through K95. The alphabetic index referred us to K06.1, gingival enlargement, and underneath that we see gingival fibromatosis. That text underneath the code is supplemental information given to help you determine that this is the correct code for the condition that you're coding. The table of neoplasms is a list that gives the codes for neoplasms by anatomical site. For each site, there are 6 possible code numbers, depending on whether the neoplasm in question is malignant, in situ, benign, of uncertain behavior, or of unspecified behavior. The description found in each column will lead you to the correct code choice. Once you have the recommended code, you again will go check it in the tabular list. Here's an example of an abdominal neoplasm in the neoplasm table. If our documentation stated it was malignant primary, we would choose C67.2. Malignant secondary, which means metastasis, would code to C79.8. Carcinoma in situ, D09.8. Benign neoplasm, D36.7. Uncertain behavior D48.7, and if it was documented as unspecified behavior, it would code to D4989. Again, it's important to also reference the tabular list to ensure that you have a complete code and to check for any additional coding notes. The table of drugs and chemicals is a listing of drugs and other chemicals that identifies codes for poisoning, adverse effects, and underdosing. This is laid out similarly to the table of neoplasms, with each drug or chemical being listed in rows and 6 columns to describe the type of incident and the recommended code. The choices are poisoning accidental, which would be unintentional poisoning of the drug, poisoning intentional, which would be an intentional self-harm, poisoning assault, poisoning undetermined, adverse effect, and underdosing. Again, you would never pull a code straight from the table of drugs and chemicals. The ICD-10 official coding guidelines tell us to always refer back to the tabular list. Remember, you need to check for additional characters in your code as well as for any instructional notes. The ICD-10-CM Index to External Causes of Injuries is a listing of the external cause of injury codes that classify injury events by mechanism and intent of injury. This is the index, and it's similar to the main alphabetic index, but it only contains listing for external causes. If your documentation described a fall, you would look up the main term fall and scan the subterms for any that are applicable. A fall from a ladder gives us the recommended code W11. Again, we use that recommended code and look it up in the tabular list as well. That's it for today. Thanks for watching, and I'll see you in the next lesson.